Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Half a day, everybody, and welcome back to Healthy Living Tuesday. Don't let the bed bugs bite. It's not only something your mother said to you probably many, many times over your childhood. There's actually some medical merit behind it. And to dissect, for lack of a better term, this phrase, Dr. Jitka Lom, the principal physician at Express Care, is here. Now, Dr. Lom, welcome.
Thank you.
We enjoy having you here as always. Okay, lice was a fairly prominent problem here on the island in the early and mid-'80s. Is it still?
It is. We still have children with lice, occasionally adults with lice. Some of them are from our island, others coming from other islands, but it's still a pretty common problem.
And what is the problem aside from, kids being itchy and like the lice being contagious? That's what everybody associates with it. What health complications can there be?
That's really it. Lice does not, the lice insect does not transmit any other diseases. It's just that it's very uncomfortable for kids. They can't concentrate when their head is itchy, and it does go to other children. But in itself, it's not really a dangerous health condition.
So no risks of like deer ticks commonly pass Lyme disease into people as well as animals and everything, nothing like that?
There's no other disease that comes from them. The only thing is that if children are scratching a lot and they have dirty fingernails, they may get an infection. That's it, from dirty skin.
But this is a problem of public health, and physicians like yourself have to look out for. And what can we do in the home to make sure that our children don't have lice, or if we perish the thought, if we suspect that they may and everything, how can we take care of that at home?
Okay. Well, if you find that your child is scratching a lot on their head, you should take a look at their hair and see if you see any nits. Those are tiny little white, actually egg sacs that are stuck onto the hair. They're about very, very tiny. They're like a pinhead. They're very, very tiny little white things stuck onto the hair shaft. And sometimes you can actually see insects jumping. Those are the live lice. If you see the live lice, then your child really does have a problem. If the nits are more than 1/4 inch out, then maybe there isn't an active problem. But if they're close to the scalp, then your child does have live lice. And then what you can do is you can buy over-the-counter products like Rid or Nix, and you can follow the directions and apply it to your child's scalp. Usually for about 8 to 10 hours, then rinse out, and then that will kill all the live lice. Now the eggs will not necessarily be killed off, so you may need to retreat in about a week.
Now, are lice like other kinds of ticks, again, where they have those hooks that literally they'll bury themselves into your dog or your cat or yourself if they even touch you and everything? And how? I don't suppose that lice, it's advisable just to pluck them out by hand. Right?
Yes, actually.
Okay.
Yeah, lice are insects. They're just jumping around, having blood meals, meaning eating a little bit of your blood, and that's why it hurts, because they bite. So there's a sensation that something's biting you, and it's also very itchy. If you didn't have access to any medication, you could actually manually remove all the lice. That would be very time-consuming and difficult. That's why the chemicals are there, to kill the lice and then just wash them out.
And is this a treatment that needs to be applied for several iterations over time, or is it a one-time deal?
Oftentimes it's one time, and then check the head in about a week and see if you see anything crawling around or jumping, or if there's any new nits that are really close to the scalp, less than 1/4 inch, really, really low down, close to the hair shaft. And if you see any live lice, then you need to retreat. But most of the time, one treatment will do it.
Okay, well, on to scabies now. As we know, Public Health actually issued not necessarily an epidemic on the island, but there was a notable uptake in scabies here. And kind of like, can you differentiate between scabies and was it foot and mouth disease?
Oh,
I believe
okay.
as it's called. And a lot of people equate that with bovine or equine, some sort of disease there. But
right, those are entirely different. So we talked about
lice.
So. Yeah, when we talked about lice, those are little tiny little insects. And scabies is also an insect. We might call them mites. They're a little bit bigger than the lice, or smaller than lice, I mean, and they burrow into your skin. And what happens is that you catch this again from other people, close contacts, like basically sharing the same bed, or just physically very close to other people. That's how you catch the scabies insect. And it will bury into your skin, and the female lays an egg every couple of days. Few eggs every couple of days, then pretty soon you have a whole lot of scabies in your body, and they're actually crawling around underneath the skin. And they tend to affect in between your web spaces here and your fingers, also between your toes, your waistline, your underarms, anywhere that's kind of warm and where there are folds of skin. And it's incredibly itchy, especially at nighttime.
So medicinally, I know that that's probably, you know, like a concern for you, especially with young children. I can say for me as a patient, on the gross factor, that's off the charts.
Yeah, it really is. The problem with kids is that, again, they're scratching themselves to death. They can't sleep at nighttime. They're very infected oftentimes, and it's super contagious. So it's important to treat the whole family if there are several people with scabies.
Okay, well, I want to talk more about the treatment of scabies, plus get to these viewer questions because we have some really good ones. So sit tight, and all of you out there in TV land, stay tuned because Healthy Living Tuesday will return. Dr. Lom is back after this.